Hello, this is Joe. I'm going to be addressing a patient I had several years ago. We'll just for identity's sake call him John John. I'm going to be addressing several domains here: patient-provider communication breakdown, disrespect for patient preferences and decision making, medical experiences leading to distrust, and medical conditions and experiences of discrimination. John John, he was born on January 3rd, 1947 on Oahu in Waipahu in Hawaii. He's a retired U.S. Army soldier. He was born up around Kaneohe Bay, where you'll find Gilligan's Island, right off Kaneohe Bay there at the Marine base. He died on February 11, 2007 at Trip Army Medical Center. Basically, he was survived by 3 sons, 1 sister, 2 brothers, and a companion who we'll just call significant other for now. The only patient funeral I have ever attended. I first met John John on January 2nd, 2006. And got to know him, and I took care of him for about over 13 months up until his death of February 11, 2007. He had many comorbidities, but most prominent, the reason he was there at the medical center was because of end-stage renal disease, which he received dialysis 3 times a week, respiratory failure, he was trached on a ventilator frequently, or blow by one or the other. He also had another prominent disorder was the schizophrenia, which I'm not sure where that diagnosis came from, but John John had been there quite a while before I arrived. And this schizophrenia is going to play a significant role into this story. So, like I said earlier, the descriptions of the domains we're going to basically cover 4. This all boils down to total disrespect for the patient preferences. First of all, we've got a problem with patient and provider communication. When the doctors made their round or John's doctors came in, they would very rarely, talk with John one-to-one. They just made all decisions related to his care, and this was basically because a lot of John's attitude was that he perceived the hospital ICU environment as being in a Hawaiian Hilton, for example. He wanted people to wait on him hand and foot, and this was because that he was diagnosed as schizophrenia, or he had some of these problems or disorders that relates to schizophrenia. There was total disrespect for patient preferences when it comes to shared decision making. A lot of the doctors, and including the nurses, would assume that John was just not capable of making decisions. I found myself over a 13-month period of this to be totally untrue. But they gave John very little say-so into his medical care. It was just basically a chore that needed to be done every day, and that's how he was addressed. Sometimes because they wouldn't listen to him, in order to be heard, sometimes John he would act out. A lot of times verbally, and occasionally physically, like kicking staff or doing things like that. Now, I know personally I had to set him straight on a couple occasions, and he pulled his trach out and threw it at me, and I literally had to put the trach back in myself. But there was decisions made later on in early 2007 that John had no say-so into whatsoever. Some of the doctors got together and decided they was going to terminate his treatment and end his life. Even though John pretty much begged there toward the end, he was just totally ignored. Sounds too much to be true, but I'm telling you, this story really happened. Um, there was a lot of neglect by the medical and nursing staff, that led to distrust between John and the providers. There's no communication between them whatsoever, very rarely. And they basically related just because of his attitude and his his mental problems. Being he was recognized as schizo, he was more or less just recognized as an object rather than as once he was a respected, prominent hula dancer in Waikiki and a pretty prominent human being around Waikiki Beach in Honolulu area. There was a lot of factors into what brought on John's ultimate demise. Him himself. It was frequently verbal abuse toward the staff. Sometimes, like I said, physical, maybe even kicking at them or throwing things at them. He refused a lot of times to do his own ADLs, which he could very well do. He could feed himself. Like I said, he wanted to be treated like he was in a resort or a health spa. He'd ask for massages, and he'd ask people to feed him, and he'd do a lot of things that were totally unnecessary that would just drive the staff to their limits at times. He did this with intensiveness. His pulmonologist, nephrologist. Even though I feel like this nephrologist, he's probably the best ally that he had at the time. They all grew intolerant of his demands and abuse, mostly verbal, and the nursing filing complaints on a regular basis. Then one day in early January 2007, this intensivist comes up and asks who John's advocate would be. And I said, well, I guess I am, because I've known him the longest, probably. Why? I'm going to withdraw his care, he announces. I'm like, well, good luck with that, Well, lo and behold, he got a bunch of doctors together. He convened an ethics committee, and the next thing we know, we were all into an ethics committee meeting. Before he went forth with that, he had counseled the family members who were very low literacy, especially John's significant other and his two sons. They had low literacy and also, especially, had no idea what healthcare issues was going on. They just knew John had been there for several years, and because of his dialysis situation and his trach situation, and he had to be monitored 24/7. So, like I said, 2007, the ethics committee was convened and basically was issued a death sentence. How they were going to do it was basically withdraw his hemodialysis care, hoping he would fall into a coma within 2 or 3 days and then pass on. So on Wednesday, January 31st, the first hemodialysis session was withheld, and noting that he'd probably pass on before the weekend was out. However, that never happened. So John lived approximately, rather than dying out the weekend, he made it until like February 11th, which was just shy of 2 weeks without dialysis. On Wednesday, before the Sunday that he died, it's that night he fell into a coma. I spoke with him Wednesday night, and he kept reiterating, Ted, why did they withhold my dialysis? I said, John, you got to talk to your provider, your doctors. Well, the moral to the story here was that they convinced the family members, they convinced the ethics committee that they were going to tell John all about this, and they really never spoke to him what their real intentions were. They had the illiterate family making all John's decisions, and never gave John a voice into, and like I said, and he just passed on out. On I think it was February 7th, he went into that coma that night. Last I spoke to him, he was still wanting to talk to his doctors and reinitiate his dialysis, which they never did. So the things that could have been done more appropriately would have been, John could have took better care of his body. He could have been more cognizant of his drinking and smoking during the early years of his life, And he could have been more appreciative to the staff about it when they were trying to take care of him instead of pushing their temperatures every day. The providers could have been in more tune with him. I don't think they did him right. Neither were they honest about what was going to happen in the ethics committee meeting. They should have been more in tune with John's mental illnesses. They just seemed to have no respect whatsoever for what his preferences were, was to sustain his own life. And they totally ignored him at the end, which I think was totally, totally wrong. As John's advocate myself, at that ethics committee, if I had to do over, I would have never caved in. It had to be 100% unanimous vote amongst about 25 people at that committee. And I know just myself and nephrologist Dr. NS, we'll just call him, were both holding out for many hours before we gave the final okay to pull the hemodialysis from John's therapy. These are the references that I utilize while putting together this story. And have a good day, and thank you for your attention.